Hey Jason, how are you?
Good, how are you?
Good, I'm Nadia. Please have a seat. Jason, the forms I'm going to take you through today is just going to help me to figure out whether you are cleared to exercise. We're going to take some baseline information to help us with your goals, and of course we're going to figure out what your goals are for today. And overall we're going to get a good picture of what your health and well-being is at the moment. So you're okay to continue?
Yeah,
fantastic. Good. All right, the first form that we're going to start off with is an adult pre-exercise screening form. So I'm going to ask you 7 questions, and all I need from you is just a simple yes or no answer, okay?
Yeah. Sounds good.
All right, so let's start. Has your doctor ever told you that you have a heart condition, or have you ever suffered a stroke?
No.
Nope. Do you ever experience unexplained pains in your chest at rest or during physical activity or exercise?
No.
Nope. Do you ever feel faint or have spells of dizziness during physical activity or exercise that causes you to lose balance?
No.
Nope. Have you had an asthma attack requiring immediate medical attention at any time over the last 12 months?
Not at all.
If you have diabetes, type 1 or 2, have you had trouble controlling your blood glucose in the last 3 months? Do you have any diagnosed muscle, bone or joint problems that you've been told could be made worse by participating in physical activity or exercise?
No.
Nope. And last question, do you have any other medical conditions that may make it dangerous for you to participate in physical activity or exercise?
No.
No. Excellent. Okay, fantastic. So I just need you to sign off. Give me your autograph there at the bottom. Great. So that indicates that you're cleared to exercise. Let me get into the next series of questions. We're going to dig a little bit deeper into what your health and fitness goals are, okay? Now, I've already pre-filled out sort of your address and your date of birth, because I already know that information. So let's start with your health and fitness goals. What's your number one goal?
Probably to tone up.
Okay, and what does tone up mean to you exactly?
Guess lose a little bit of weight and put on some muscle.
Great.
Yeah.
And when would you like to achieve this by?
Like 3 months.
3 months? Okay.
Yeah.
Any other important goals?
Guess a little bit of fitness.
Okay. Okay. What do you need to do that you think to be successful?
What do you mean by that?
So what do you think you need to do right now in order for you to achieve your goals?
Just commit. Yeah, train.
Okay. So commit and do the exercise?
Yep, do the exercise.
Okay, perfect. All right, I'm going to dig a little deeper into you. So are you currently exercising?
Yes.
Yeah, how often?
Maybe 2 times a week.
2 times a week, okay. And for how long would you say?
About an hour.
About an hour per session?
Yeah.
And what sort of intensity would you say you're training at?
Say moderate, about medium, yeah.
About moderate, okay. What are you currently doing?
Just a little bit of gym work.
So weights?
Yeah.
So a little bit of weights, okay. Excellent. So I know that you haven't been pregnant lately, have you?
No.
No. Are you taking any other medication?
No.
Nope. Okay, fabulous. So I'm just going to do a really quick health check. We're going to start with your resting heart rate. So can I please have your hand up on the table? This is pretty simple. I'm going to put my hand on your wrist and find your pulse, and then I'm going to take it for 15 seconds, okay? So just bear with me. Excellent. Okay, so that was 15. So your heart rate at the moment is 60 beats per minute, which is awesome. I also would like to take your BMI. So what's your weight, do you know?
I'm about 80 kilos.
Okay, and do you know what your height is?
About 180 centimetres.
Okay, fantastic. All right, so that calculation brings you to a BMI of 24.7, which is good. Almost there. So we take the blood pressure cuff, or the sphygmomanometer, and place it on a client's arms about 3 centimetres above the fold of the elbow, making sure that the pipes run down the medial aspect of the arm. So I'm just going to move you. We place the face where you can see it. Next we take the stethoscope, and it's important to make sure that the ears are pointing down towards your nose and they are forward, like so. We place the bell of the stethoscope in the medial portion of the arm. Now from here, make sure we turn righty-tighty. We're going to inflate the pump up to about 200. Now I will slowly deflate the cuff, listening out for the first hard heartbeat. Make sure you deflate the cuff entirely. And then remove it from your client's arm. We record the first hard heartbeat, that's the systolic pressure, and we record the last hard heartbeat, which is the diastolic. Make sure you pop this onto your form. Now let's look at your lifestyle. So how active would you say your job is? Sedentary, light, moderate activity, or strenuous activity?
Say light.
Light?
Yeah.
And how active is your day? Sedentary, light activity, moderate activity, or strenuous? About the same?
Yeah.
Let's talk about your sleep. How many hours of sleep do you get on average per night? Less than 7 hours, 7 to 9, or more than 9 hours, sorry?
7 to 9, about 8.
Yeah, okay, good. In the past month, how often have you been physically restricted by your health? Or in other words, been unable to perform ADLs? And that's just another way of us saying activities of daily living.
I've been pretty good, been okay.
So would you say never, once or twice, once a week, once a day, or you're always restricted?
Never.
Never? In the past month, how often have you been emotionally affected by your health? Never, once or twice, once a week, once a day, or always?
Say never.
Never? Okay, so I'm going to ask you a couple of statements regarding your diet and just let me know which ones suit you the most. I feel that my diet is healthy and does not require changing. I feel that there are a few changes I could make to my diet to improve my health. Or lastly, I feel that my diet requires a number of changes and I am not sure where to start.
I think a few changes, so the second one.
Second one, so I feel like there are a few changes I could make to my diet to improve. Okay. So with that in mind, we can do a little bit of a nutrition consultation just to help you out and to help you accelerate your results.
Sounds good.
All right, so let's talk about your exercise plan. So you mentioned that you need to commit. You are doing something already. Realistically, how much time can you commit to your exercise plan per week?
Say 5 days.
5 days?
I'll say an hour each time.
So that's been realistic?
Yep.
Okay. So 5 times per week for about 60 minutes.
Yeah.
And what time of day do you prefer to exercise? In the morning, in the midday, afternoon, or evening?
Afternoon.
Afternoon.
Yep.
So you've set up 5 days. So what days are you looking at training? Monday through to Saturday, Sunday?
Probably Monday to Friday.
Monday to Friday?
Yep.
Awesome. We've got a few different things here, and I might get you to have a look here. So what fitness activities interest you? We've got walking, running, stationary cycling, rowing, swimming, cross trainer, weights, free weights.
I like running and I like weights.
You like running and you like weights. Machine weights or free weights?
Both. Machine
Both.
and free, yeah.
Great. Any group exercise classes or anything?
Not really.
Nope,
No.
not your bag.
No.
Anything else, such as sport?
I don't mind sport. Yeah.
Okay. And what intensity would you like to exercise at? Do you want to say low, moderate, or high?
Say moderate.
Good. And is there anything or any fitness activities that does not interest you at all?
I don't really like riding on the bike.
Okay. So no riding on bike. Great. Awesome. So we've got some awesome information there that we can take away and use. I'd just like you to have a quick read over here on this disclaimer. And once you've read that and you've understood it, can I please have your signature there, and we'll date that as well. So you're not signing your life away here. It's just a Thank you.
Thank you.
It's just so that you've read, it's just so we know that you've read and understand some of the possible risks attached to exercising.
Cool.
Fantastic. Okay, so we're going to do a couple more fitness measurements.
Sounds good.
Great.
Thank you.